mentioning of what appear to be reinfection, you have to really be very careful when you say reinfection, because what and we were dealing with this with even Ebola back during the Ebola time, that someone might still, when someone does a test on them, do a PCR on a body fluid of some sort and be able to detect what are likely nucleotides that are not replication competent. So if you're telling me, which I don't think they're saying, that someone has coronavirus disease, they get sick, it's documented, they get better, and then a month or so later, they get sick with documented coronavirus disease. I don't think that's what they're saying, but I don't want to jump the gun on it until I see the data.
They use the word reactivate. Is that different?
Yeah. Well, yeah, what reactivating what means is that it depends what you mean by reactivating. If someone clearly is ill and they have virus isolated from them, that you may have a prolonged course. I'd like to see how long they reactivate. I mean, if they were sick and had documented virus, and then 3 months later they had documented virus, is that reactivation or is that infection with another virus? I'd like to see the data before I really comment on that. Yeah.
Dr. Fauci, I wanted to ask about medical criteria. You had a discussion with Dr. Birx and the other public health experts on Tuesday, I understand. Can you discuss what is the medical criteria that you guys are discussing in order to reopen the government? What is the medical criteria?
Well, it's less medical criteria than it is public health criteria. And that is, and I think it's really important because often people say reopen the government like it's a light switch that goes on and off for the entire country. We have a very large country with really different patterns of disease and outbreaks in different parts of the country. So it's not going to be a one-size-fits-all. It's going to be, what is the kinetics of an outbreak? Is it on the way down? Is it essentially out? Is it still smoldering and possibly going up? I think you're going to have to take it individually. And
are there some benchmarks that you're looking at, though? I mean, are there some numbers that you're looking at, some data that you would like to see? What would you like to see before that happens?
Yeah, well, I will allow Dr. Birx to come up with just my own opinion. I don't think they're going to be benchmarks that are going to be consistent from one to the other. For example, I would not want to pull back at all in New York until I was clear that that curve really was doing what we've seen in other countries, a very steep decline down, and we had the capability, if there was a resurgence, of having everything in place to be able to do the containment as opposed to struggling with mitigation with what we've been doing. That's different than a relatively smaller city, town, or whatever you, in the Midwest or mountain regions, which is generally very well controlled. What I would want to see, do we have the capability of doing the isolation, contact tracing, and suppression of it? So it really varies differently. So I don't think there's one medical criteria. But Deb, if you want to speak to it.
Thank you. So it's what I tried to